आयुष्मान भारत योजना के तहत गांव के पास ही वेलनेस सेंटर्स बनाए जा रहे हैं ताकि लोगों को इलाज के लिए बहुत दूर न जाना पड़े।
This week, India is marking 6 years since the launch of the Ayushman Bharat Scheme in 2018, when Prime Minister Narendra Modi unveiled the most ambitious welfare scheme aiming to cover over 50 crore Indians. 6 years on, the Ayushman Bharat Scheme has become the world's largest healthcare insurance program, covering more people than the population of the United States. Over 35.5 crore Ayushman cards have been issued under the scheme, and in these 6 years, more than 7.4 crore Indians have received treatment. Half of these beneficiaries are women. The scheme's aim ultimately is to deliver affordable healthcare by providing coverage of Rs 5 lakh per family per year for secondary and tertiary hospitalization. From cancer to bypass surgeries and kidney transplants, this scheme covers over 1,900 procedures, saving countless lives. While the healthcare insurance industry, driven by private players, has made strides, it remains a difficult expense for most Indians. Ayushman Bharat has created a culture of health insurance among India's poor and lower middle class. Health insurance is no longer a privilege but a widespread reality, especially for India's poorest. What's more, this flagship scheme has actually taken off, and it is delivering in real time, making more people believe in health insurance than ever. This ultimately aims to prevent them from falling into the debt trap of medical bills. And this isn't just about healthcare. It's about combating poverty and preventing financial disasters like medical bankruptcy from wrecking homes. Oftentimes, a short hospital visit could financially devastate a poor family in India, and that's what Ayushman Bharat aims to combat. The World Health Organization, or the WHO, estimates that up to 5% of India's population falls into poverty each year due to healthcare costs. Targeting this problem, Ayushman Bharat has drastically reduced out-of-pocket expenses, saving families from financial ruin. A whopping amount of 1 lakh crore rupees has already been spent on treatments under this scheme, and that amount keeps growing each year. Now, which states are seeing the most hospitalizations? The top states under Ayushman Bharat in terms of hospitalization rates are Tamil Nadu, Karnataka, Rajasthan, Kerala, Andhra Pradesh, and Gujarat. Together, these states account for the highest number of treatments. And here's what's next. In October, Prime Minister Modi is set to roll out a new tier of Ayushman Bharat covering all Indian senior citizens over the age of 70. This is a huge step towards ensuring affordable healthcare for the elderly, protecting them and their families from the financial burden of medical care. Several challenges also remain, however. Odisha, Delhi, and West Bengal have still not implemented the scheme over differences with the centre. Medical bills addressed to the government are piling up in states like Punjab, where the state government is struggling to pay its dues. This has also led to some hospitals denying treatment for intended beneficiaries. Another challenge is the varying rate of hospitalization across states. States like Bihar, Uttar Pradesh, and Assam have a lot of catching up to do in comparison with their richer peers. With such a massive number of health beneficiaries, improving health infrastructure will be key to the scheme's success in the future. This also means that the proliferation and enhancement of government hospitals is required other than private hospitals, where most patients prefer to go for serious ailments. Ayushman Bharat continues to remain a work in progress. Its popularity remains intact even 6 years after its launch. More people are signing up for it owing to its incredible impact. Ayushman Bharat card issuances have surged, growing by 42% to 35.5 crore as of September 23rd, compared to the same period last year. Hospitalizations under the scheme have also seen a notable increase of 19.9% during this time. Moreover, government spending on the program has also increased significantly. For the fiscal year of 2025, the government has earmarked Rs 7,300 crore for the scheme, marking a 6% rise over the revised estimates of FY24. You see, Ayushman Bharat isn't just a health scheme. It's a lifeline for millions. It's preventing poverty, ensuring healthcare access for the most vulnerable, and changing the face of healthcare in India. As the scheme continues to grow, it's not just saving lives, it's securing futures. Prime Minister Narendra Modi has acknowledged that India's growth as a nation depends fundamentally on the health of its people. A nation in poor health cannot thrive. This realization has led to the launch of initiatives like Fit India and Khelo India, aimed at promoting fitness and sports culture across the country. But the most transformative initiative has been the Ayushman Bharat Scheme, owing to the vast financial commitment to the people that it ties the Indian state with. Moreover, most of the Prime Minister's political opposition has also participated extensively in the implementation of the scheme through the states ruled by them. So this is more than just about healthcare, as I said. This is about nation building at the end of the day. Poor health without sufficient care can act as a drag not only on an individual but also the economy. By ensuring millions of people under Ayushman Bharat, India is not just addressing immediate health needs, but it's investing in the nation's long-term economic prosperity. A healthy population is crucial for a strong workforce, greater productivity, and sustained economic growth. In Modi's vision, by ensuring healthcare for the most vulnerable, India is ensuring its own future as a Viksit Bharat, a developed, prosperous nation.